First of all, I thank you to invite me here and give opportunity to get together with you. Many greetings from your neighborhood, from Turkey, on the other side of the sea. I'm really glad to be here. About the medical data management, can anybody find the lung cancers in the last 1 year in this mass in your hospital? Nobody? Probably somebody, but it takes a long time. So, what we do for healthcare core messaging, we need a vision first to discover, integrate, and deliver precise information. And then you need a value. Afterwards, you need a perception for every health system, searching for an integrated enterprise approach that maximizes the value of your hospital. What you have to do is, for your hospital, you need a core messaging, health core messaging. For hospitals and imaging facilities, look to derive their maximum value from their technology investments. The approach is a modular approach to securely capture, manage, view, and share vital information with core healthcare applications. Afterwards, you completing the patient records in this core. Well, before the digitalizing, you have limited access for clinicians. You have ophthalmology, pathology, cardiology, and other departments, and they are working individually. Afterwards, you have access for clinicians from every department, and every department, every enterprise storage the focus, and healthcare information systems integrate for access control. And you need to medical device connectivity as well, not only for the radiology, so you need for laboratory information systems and central information systems and hospital information systems and connect it to the medical devices. So you need, first of all, connectivity for all the devices, and on the other hand, you need interoperability of all the medical devices and all the vital signs and lab results together. But the challenge is about that, you need the right information at the right time, to the right person, at the right place. So you need a big data management. Before that, you have scanned documents, and then you need radiology, cardiology imagings, which you need also the gigabytes. What else? You have supporting content and digital pathology, and then you need genomics. So you need terabytes, petabytes, and exabytes. So you have to manage your system to go through all the physicians, radiologists, and other surgeons and oncologists to see all those things together regarding to the patient's view. So for the integrated information architect, you have the business applications and EMR, but those are all connected as a modular approach to securely capture and manage and view and share this vital information with core healthcare applications. Now we are on the medical data management today. If you remember the first slide, that mess, now we have decision supports, workflow supports, and then we have quality improvement and improve the financial outcome. From this point, I would like to give you some examples from my hospital, which is nearby to Izmir. Izmir is on the western part of Turkey. You probably know where it is. This is a structured anamnesis screen for the patient, for the physician and the nurses as well. As soon as a patient arrives to the emergency room or to the outpatient room, the physician has to fill up this screen. On the left side, you see the chronic disease, allergies, pregnancy, history, habits, and the measurements. So the physician has to fill up those things, first of all. And then on this side, you see the physical examination screen. And those are the names here, right here. And on the right side, the system gives you some suspicious and like headache, fever, or chest pain kind of things, and some diagnoses that can be regarding to that physical examinations. All the physicians has to fill up this screen first of all. And this is a screen for the physician and nurse screen. We have, oops, sorry about it. Yeah. This is a name, and we have some icons here about like pregnancy, if this patient has a pregnancy, prosthesis, isolation, allergy, fall risk, pain, coming order, counter visit, and blood order, equipment changing for scales, and order stop. This screen can be seen by the physician and the nurse anytime. So you can follow up the patient regarding to this screen. And we can also see the vital signs on the screen because we are a paperless hospital. Any of those, the respiratory rate, the body temperature, pulse, heart rate, and the blood pressure like this. And we have some reminders like PSA test for over 50 years man once a year, or colonoscopy, pregnancy reminder for radiology, and hemoglobin A1C test for the diabetic people who doesn't have any hemoglobin A1C result previously. And according to the catheter changing time that we saw the previous slide. And also we have some alerts on the system about this test, like potassium, calcium, CRP, pathology, malign or suspicious, and radiology for malign and suspicious, antibiogram, radiology order if this patient has a pregnancy, warns you, and vital signs that set by the physician if it's high or low, depending on. And we have some decision support systems that you are supposed to have for the MRAM stage 7. Like this is for sepsis CDSS warning. This was triggered by somehow. I'll show you how it triggers. This is kind of a pathology warning screen. This all pops up the physician's screen as soon as he opens his own page on the computer. This is a shock screen. And we have an auto-transfusion reminder. This is set by us. If the patient is going for orthopedic surgery hip surgery or knee surgery, if the patient is eligible for autotransfusion, like if the patient is less than 65 years old and CRP is normal, hemoglobin level is over 12, and sediment ESR is normal. So the system alerts, actually not alerts, reminds you that this patient is eligible for autotransfusion, and we get one pack of blood from this patient to use it during the operation. By this way, we have about 70% saving about the consumption of the blood during the operations. We have some drug decision support systems, as you see in drug lab results, drug vital sign decision supports, drug chronic disease decision supports, and drug allergy and drug dose, and those alerts on decision supports as well. This is how physician decision support works. There is an initial must for decision support. This data is coming from the first screen on that structured anamnesis screen: age, gender, laboratory results, vital signs, and symptoms and diagnosis. And it triggers the supporting data on CDSS, the chronic disease, age, pregnancy, whatever. And then triggers the order sets on CDSS, and then gives you a workflow on CDSS. This sepsis decision support, how it works, we set it on if the heart rate is over 90, if respiratory rate is over 20, if the body temperature is over 38, and white blood cells over 12,000. So at least two of this criteria is positive. The system triggers and gives alert to the physician, either on the screen as a pop-up or sending SMS to his cell phone. This is another decision support. Here you see auto BMI score right here. And this system takes for any patient, if there is any request for specific lab results, lab test systems, starts to measuring and calculating of MELD. And then auto calculation of MELD value, if it's increased MELD, health score, child score. And then the system automatically gets the results from the laboratory. And also we have the auto recognition in textual content, such as radiological or pathological reports, by using the OCR engine. Yes, by this way we got some benefits about it. The save time, you see what we got from 2014 to 2015. Thank you for your support. Let's meet where the continents meet in Istanbul for the next year in HIMSS 18 Turkey.